Confirmed cases of COVID-19 in Nigeria hits 3,000 plus. More donation of palliatives by concerned groups and individuals as pandemic rages. And focus today is on protecting the elderly in this period of coronavirus scourge. A very good evening to you and a warm welcome to the news tonight. I am Agatha Egwarioju. 381 new cases of COVID-19 have been reported by the Nigeria Center for Disease Control (NCDC), bringing the total number of confirmed cases in the country to 3,526. A breakdown of the new cases indicates that Lagos has 183, Kano 55, Jigawa 44, Zamfara 1, Bauchi 19, Katsina 11, and Borno 9. 8 new cases are in Kwara State, 7 in Kaduna, 6 in Gombe, while Ogun has 5, Sokoto 4, Oyo and Rivers 3, and 1 each in Akwa Ibom, Enugu, and Plateau states. So far, 601 patients have been discharged, while 107 deaths have been recorded. Now, Edo State has not recorded a new case of the virus in the last 2 days. The Edo State coronavirus incidence report of today states that there is no new confirmed case of the virus. It, however, puts the total number of confirmed cases in the state at 65 and active cases 51. Total number of patients discharged is 12 and 4 deaths recorded. In the meantime, 2 more COVID-19 patients in the state have been discharged after testing negative twice for the coronavirus. Governor Gordon Obaseki disclosed this on his official Twitter handle today at 2:56 p.m. This brings the number of patients managed and discharged from isolation centers in the state to 12. The governor in the tweet is seeking support of the people as efforts to contain the pandemic is intensified. Now, the Presidential Task Force on COVID-19 says it has received reports from states which suggests that treatment centers are running out of bed spaces. Chairman of the task force and Secretary to the government of the Federation, Boss Mustafa, said this in the briefing of the task force today. Other highlights at the briefing are that all persons exempted from curfew, including journalists and medical personnel, should always carry a verifiable and authentic means of identification. Security agents should improve monitoring of their personnel and interaction with the citizenry, who should also respect the sacrificial role of the agents. Now, since the outbreak of COVID-19, medical experts have maintained that the elderly are significantly at risk of contracting the virus and have severe symptoms, especially for those with underlying illnesses. NTA's Good Morning Nigeria today focused on how the elderly can be protected and cared for in the midst of the pandemic. Joy Egu has an excerpt of the contribution of a consultant geriatrician in the UBTH, Professor Obehi Akoria, who was guest from the Benin Network Center.
Statistics from the World Health Organization indicate that about 95% of COVID-19 deaths occurred in persons who are 60 years and above, while 8 out of 10 deaths are occurring in those with underlying illness like cardiovascular disease, hypertension, and diabetes. Professor Obey Akoria threw light on how to protect, care, and support the elderly in the midst of the pandemic.
It will be easier for an older person to relate to a message that is coming from someone from a similar age category rather than to a young person who is speaking. So one way to do it is to change the whole structure about how we are sending out messages right now. Inclusiveness requires, in my perspective, that we get older persons who are well, who are strong, who are, even the older the better, and get them to join the team that is providing the messaging. You are ill, get treated as quickly as possible.
Guests on the program advised all Nigerians, irrespective of age, to wear face masks, practice social distancing and hand washing, or use hand sanitizer to stay safe. In Benin, Joy Egbo, NTA News.
Now, increasing reports of the elderly being denied access to medical care in some health facilities has become a source of concern. Adobejo Jegba was out to find out the true situation.
These elderly men and women say they have witnessed situations where the elderly have been allegedly turned back in government facilities.
It's not good now. Where they say me they don't go, where they say me they treat the sickness. Not be doctor will treat them. Not be that they pay them for.
There was also my relation who is sick that they should rush to the hospital. He got there, all the nurses were running away from her. So what she did now, we took her back home. Then we now go buy all those native medicine called agbo, that's herbs and roots. So because most of the nurses now, they are afraid now, maybe somebody have a BP, have a high pressure or maybe high temperature now. And they might think that he has connected that disease.
However, a visit by the news crew to ascertain the true position revealed that the aged, like other patients, were being attended to by medical personnel. Authorities have dismissed the reports making the round as false. Commissioner for Health, Dr. Patrick Okundia, says it is fake news. In Benin, Adobeji Ojegba, NTA News.
And in the studio to discuss more on the elderly being turned back at treatment centers, and of course what to do to protect them from the virus, is Dr. Omo Ikiruda Orezimena, Resident Doctor, Department of Community Health, UBTH. You're welcome.
Yeah, Gata. Good evening.
Good evening. All right, you just listened to that report. You're a doctor in Community Health Department of the UBTH. What are your thoughts concerning that?
Okay, the elderly are a special group of people. They are people who are aged 60 years and above, especially for us in Nigeria. In developed countries, the people who are aged from 65 years and above. And this group of people are indeed very special because they're a vulnerable group. The elderly are actually given a lot of attention, especially in public health institutions, one of which is UBTH, where they give them preference when it comes to hospital care and access to health care. I, for instance, can attest to the fact that elderly people have separate queues when they stand in the hospital so they don't have a long waiting period, and then priority is given to them because they need care as urgent as possible. The elderly people, I've never heard of them being denied care or turned back at health facilities. So I want to agree with our commissioner who has said that this news is incorrect. As like I said, there is a special group of people that are actually giving special care.
Okay. Since the outbreak of the coronavirus, medical experts have maintained that these elderly people, they are vulnerable to the coronavirus. What should be done to protect them from the virus?
Okay. The elderly
Anything different?
The elderly people are indeed very vulnerable to this virus because at that age in life, their immunity actually goes down. The elderly people, like I said, are 60 years and above for us in Nigeria. And to optimize their health, the elderly people also have comorbidities at that age, meaning that they are more prone to having illnesses like cardiovascular diseases, hypertension, and diabetes. And these illnesses tend to reduce their immunity and put them at risk of any form of infection and other diseases, especially COVID-19, as we are discussing today in the studio. And ways in which you can help our elderly people to live healthier lives and reduce their risk of contacting the virus is by helping them boost their immunity. One of the things they must do is to ensure that they eat healthy meals, take fruits, take vegetables to build their immunity, and also for those who have comorbidities to adhere to their medications. This is not the time for you to say you want to skip your medications and wait for like a week or two before you restock. You must ensure that your medications are always available, you take them as at when due, and if possible, go to the clinic for a follow-up. The elderly people must ensure that they also practice all other measures that they put in the community to help mitigate the spread of this illness. As pertains to other age groups, such as hand washing, which we've been emphasizing all over the state, they must ensure to keep their hands clean. The hands are the major means by which infections can come to the body. Like we all know, the coronavirus COVID-19 is a droplet infection, and it can be spread from droplets which can transmit to our eyes, our nose, or our mouth. So they must make sure that at all points in time their hands are clean. They should wash their hands with soap and water, and if they don't have that available, the hand sanitizers are there for them to use. Also, the use of face mask. We cannot overemphasize the use of face masks. We were around Benin City yesterday assessing private healthcare facilities, laboratories, and pharmacy stores, which can be used to expand our screening centers in the state. And we realized that most people in the state still don't believe that COVID-19 is real. They actually think that it only belongs to, it's only for those who are in the high class. But I must say today that COVID-19 is real. We have seen cases in our health institution. We thank God for those who are recovering by the day. It's just that for us in Nigeria, our mortality rates are quite reduced, but COVID-19 is real. And so the use of face mask must be emphasized, both by the elderly and other age groups, because it's a barrier that helps to prevent the droplets from getting into these areas I've mentioned, especially the nose and the mouth. I was around town yesterday. I discovered that people just hang the face masks on their chin. Some just put them in their cars. It has become a fashion statement in those states. It no longer covers. Then when they want to talk, they pull it down. They talk outside the mask. People want to sneeze, they want to cough out, they do that outside the mask, which is not to be so. It is meant to be worn. Some people complain that they feel quite uncomfortable, they don't breathe well because they are not used to it. But I must say today that yes, for the first few minutes you may feel uncomfortable, but as time goes on you adjust to it. Face masks are very comfortable, and it's essential that you protect yourself and protect your neighbor by using face masks. Another way we can also protect ourselves is social distancing. The NCDC and WHO says at least 1 meter. Now they've extended to 2 meters. Social distancing, because the droplets are going to move in the air. And what can protect you is when it doesn't come to you, it doesn't get to you, it travels. So we should try and imbibe all these things that have been put in by our state government. We should also ensure that we practice respiratory hygiene, like we've always said, sneeze or cough in your elbows, use a tissue to discard it, and ensure that you stay healthy this period. This is not the time for you to expose yourself unnecessarily. For our elderly people, if where you're going to is not important, please stay at home.
All right.
Thank you very much.
Thank you so much, Dr. Orezimena, for your time.
Thank you very much.
Okay, we'll take a break now. The news continues shortly. To stay tuned.
This is so glorious. Our government, both federal and state, we are trying to allay our fears and all that. It's really very dreadful because that is the truth. It's really very dreadful. Face the truth, so manufacturers be scared of this virus because if schools are shutting down, the United States are shutting down institutions, UK, European countries, Nigeria is banning travel from 13 states that are European states, that are the states of supposed greener pastures, where people used to run for greener pastures, for better life, and now we are restricting travel from these countries. I think that is a very serious matter.
Mama, Uncle Kim just called me. His wife just gave birth. Hey! If not be God, though, now who go do am? Now who go do am?
Hey, I thank God. Boy or girl?
I was too excited to ask. Let me get my phone and call him. Mama, it's a... Mama, what's wrong?
So, I no fit see my grandpikin now as dem do obodo oyibo.
Mama, I have a surprise that will cheer you up.
Introducing Sunday Data Plan. Enjoy Sunday browsing. 200 Naira gets you a whopping 1.25 gigabytes. Unlimited.
Next time you visit the ancient city of Benin, 2 things will excite you: the warmth and welcome of its people, and of course, the class and style of its hospitality business. Randeki Gold, home of hospitality like no other. Located in one of the most serene environments in the ancient city. Truly classy and exquisite with world-class facilities. Fully equipped digital multipurpose hall with life-size, ultra-high definition LED screen. 180 square meters king-size swimming pool with bubble bath. Enough to leave you breathless. The exotic Ariel's Bistro and Grill restaurant with variety of continental dishes, especially some of the rarest delicacies you can find in town. Fact is, a visit will truly convince you that we are gold. Randeki Gold is the gold wing of the prestigious Randeki Royal Hotel at 6 Henry Street off Ihama and Boundary Roads, GRA Benin City. www.randekihotels.com. Randeki Gold, our hospitality is gold.
God be with you till we meet again.
10 years in mind, sweet memories of your loving kindness, peaceful disposition, jovial personality, and greatness overwhelms our hearts as we remember you today and always. Our husband, father, brother, and grandfather, Mr. Ransford Orishedbemi Slater, aka Casino Manager of Hotel de Jordan. You are irreplaceable, Olobo Joso. The vacuum left behind cannot be filled. We thank God and are consoled that we will surely meet you again on the day of resurrection. Sleep on, Daddy. To live in the hearts of those who love you is not to die. You will forever be in our hearts, dearest Daddy. We, the entire family, thank God for the life you lived. Fondly remembered by your wife, children, grandchildren, brothers, sisters, nephews, nieces, and the entire Slater family.
2020 don't come with ogbonge travel awufo. Muyi Line, the transport company where get everybody for mind. Say comfortable traveling no suppose tear pocket o. As awu bonanza price still dey from Benin to Lagos, mine to Yanakwaja Yaba and Aja for just 2,500 naira. Benin to Port Harcourt 2,000 naira plus cheap awu price. So worry Bayelsa and Niger Delta routes, including Ekpoma, Auchi and Abuja. Muyi Line executive charter cars like Toyota Corolla, Toyota Camry, and Sienna dey to local and international airports and anywhere for Nigeria. Save money, enjoy safe and comfortable journey as this travel awoof day till June 30th, 2020. Muyi Line head office day 169 Oselu Lagos Road, opposite Technical Junction, Benin City. Muyi Line, friend of Nigeria students.
Thank you for staying tuned. Secretaries of local government councils in Edo State have joined the League of well-meaning individuals and groups donating to support efforts of the state government to cushion the effects of the ravaging coronavirus. They were in Government House to donate 305 kg bags of beans and other food items. Good luck in reports.
Governor Godmo Baseki received the APC chieftains, after which he directed the secretary to the state government, Osarodon Oge, to receive the relief items on behalf of government.
Representing these 300 bags of beans to support the government in its good work to humanity.
The SSG conveyed government's appreciation to the donors with an assurance that they will be evenly distributed.
On behalf of the government and people of Edo State, I want to thank you for this kind gesture. APC is the ruling party in Edo State. And if Edo people are going through difficult times, we are happy to see the party that is in power coming out to show its support to the people of Edo State. COVID was unexpected. Nobody planned for it. No government appropriated for it, but it came, and we have to face the challenge.
The government used the event to encourage other public-spirited persons and groups to give the required support needed in fighting COVID-19. In Benin, good luck in Aini. NT News.
And wife of the governor, Betsy Opaseki, has allayed fears over the rising number of COVID-19 cases in the state, attributing it to effective screening and testing. She made the clarification while presenting the fifth tranche of relief materials to some vulnerable persons in the state. Again, here is Goodluck Inaini with the report.
Items for distribution in the 5th tranche include face masks, hand-washing buckets, bags of beans, bags of rice, onions, and cartons of noodles. But first, the governor's wife, flanked by the wife of the deputy governor Mariam Shaibu, allayed fears of rising numbers of infected persons in Edo State. It is a result of effective and robust screening and testing.
Testing was very difficult initially, but now we've acquired testing kits, testing machines, setting up testing centers, and getting the PCR machines to test. And we have quite, we have more than any other state in the country, apart from Lagos State. So there's a lot of testing going on now. So as testings are going on, you'll be hearing the numbers in Edo will be going up. It's not that Edo hasn't managed the situation well. It is just that Edo is just managing, is doing the right thing and managing properly by testing many people. You'll be seeing the numbers rise. It's a good thing because it's showing up those who have it so that they can be treated.
Mrs. Obaseki urged the beneficiaries to see the present circumstance as an act of God. Earlier, the First Lady took delivery of over 2,000 items from the Church of God Mission International as its contribution to government in the fight against COVID-19.
She's been a strong supporter of not just the government, of society. I mean that she, as a leader in the community of Christians, he says her leadership has been exemplary and her support.
The exercise continues. In Benin, good luck in Aini, NT News.
And St. Maria Goretti Old Girls Association has donated food items as palliatives to the people in Ugbekun quarters, Benin, to ease the hardship caused by partial lockdown in the state to curb spread of the coronavirus. From Okafo has details.
The saying, charity begins at home, is demonstrated here by the St. Maria Goretti Old Girls Association as they reach out to the host community of their alma mater Ugbekun quarters in this period of COVID-19 scourge. Apart from educating the beneficiaries on safety measures to avoid contracting the virus, the people were given food items.
I'm very happy because it will really go a long way for I and my family. I thank the Old Girls Association when they do this good thing for us. May God will bless them.
Gode kwarai sosai da gaske. Allah saka da alheri. Allah ya biya.
God continue to bless them more and more. I pray for great success to the work of their hands. This is opportunity to talk to parents that they should not enroll their children in private school. There is nothing there. Children attended here, who enroll here, they are making it.
The Odewe of Ugbeku, Gabriel Akionbare, is full of prayers for the association.
I was so happy to come here. I bless them. May God bless the school. I bless the elder, bless the children.
For the old girls, this is just the first batch.
A lot of people are suffering. We have the people, the poorest of the poor. Even they can be looking beautiful, so they have 3 square meals. So we just felt, let us try and assist them and do something to help them, so that at least they can have at least a meal over their table.
I mean, in the society, there are people who do not have, and because of this COVID-19 issues, people are people find it difficult to make money now, and so giving them small palliatives will help.
St. Maria Goretti Old Girls Association, which is more than 60 years, is made up of old students of St. Maria Goretti Girls Grammar School, Benin City, established by missionaries in 1959. The old girls have helped give a first lift to their alma mater. They have renovated structures, built and equipped laboratories, and given scholarships to indigent brilliant students of their school. In Benin, Ifoma Ukafo, NTA News.
The news ends right after this break. So stay tuned.
Painful exit with heavy heart and total submission to the will of God, we announce the transition to eternal glory of Prince Ayodele Oluboje, great-grandson of Obayaweka of the Great Benin Kingdom, who slept in the Lord on the 1st of May 2020, age 66. He survived by wife, children, grandchildren, brothers and sisters. Amongst whom are Princess Itoan Franka Aragboye, Prince Adedeji Adewumi Eweka, Princess Abiodun Keshiro, Prince Kola Omojola, Princess Kofra Warala Ezemandu, Princess Iyabo Anamali. Burial arrangement as announced by the family. Signed, Prince Vincent Clifford Ogesoba Eweka, Princess Franka Aragboye, Barrister Mrs. Lillian Idowu Faloyi, and Princess Mrs. Margaret Uyi Jones Bazwaye.
Stay indoors, wash your hands regularly, stay safe and stay healthy. Indomie noodles, tasty nutrition, good for you.
I need you like you need me, and I know it's awesome, my baby. Ni baba,
Glow Stay Home Data Plan. All existing Glow customers now enjoy up to 20% more data. Glow Unlimited.
Improved household hygiene is essential to keep your family safe. Did you know that the sodium hypochlorite, the active ingredient in hypo bleach, is equipped to fight viruses and germs? Add some bleach to water, soak a clean napkin in diluted bleach, and wipe off germs from common contact surfaces. Wipe off with hypo. Disinfect your home with hypo bleach always.
Endorsed by the Nigerian Medical Association.
All meals and motors. Now safety of all our passengers be number one.
Thank you for staying on. Edo-Ondo boundary by Ibilo in Akoko Edo local government area is still open to travelers despite ban on interstate movement except those conveying essential items. Victor Ojon Achar reports that compliance level in that axis remains low.
Almost 2 weeks after President Muhammadu Buhari placed a ban on interstate movement, the enforcement of the order is yet to commence at this boundary between Edo and Ondo State. A visit to the boundary at Ibilo shows a low level of compliance as there is still influx of vehicles in and out of the two states. Although there are security operatives at both ends of the states, vehicles are still allowed to travel after normal road check.
Going to Isio. I'm selling bracer. From Okene to Ethiopia, I get farm for Ethiopia. I beg them that I want to carry food from my farm here. They say I should go to Ibadan.
How is the road from Bokoda to this place?
Very, very difficult. Stopping and stopping. Before you passed, there is one place there. They check you. They will carry a testing this thing. The weather, the temperature test, they will test you before you passed. I'm on duty, I'm an officer. I'm going back to my duty post.
I tried some inner road when they for me, I pass them, but as I reach here now, they say no way, I accept I back to home.
Essential stuff. Okay. Yeah.
Okay, you have a...
Yes, yes.
Stakeholders are urging security agencies to adopt more stringent measures and task force set up by the various states to enforce the order. In Ayoron, Victor Odion Acha, NTA News.
That concludes the bulletin tonight. Thank you for watching. Stay safe.
10 years in mind, late Madam Gertrude Irigu Eromosele. It's exactly 10 years today since you departed this world to be with the Lord. We think about you, we talk about you. Still, you were not just a perfect mother, but also an amazing teacher. All the good things we